from the station that's on your side. This is Channel 7 News Midday.
Welcome back to kick off February and Heart Awareness Month. Tonight here on Channel 7, we have physicians from Baptist Health Heart Institute on hand to answer your heart questions. One of those physicians, Dr. Patrick Campbell, a board-certified heart failure cardiologist, is with me now to answer some of the questions we received from you. So thanks so much for being here.
Thanks for having me. Happy to be here.
All right, let's start with the first one. One caller asks, how important is it to eat 2 servings of fish each week for heart health? And if you had to pick 1 or 2 foods that are most heart healthy, which would they be?
Well, I think obviously eating healthy is really just making sure you eat everything in moderation. You want to eat fresh fruits and vegetables. 2 servings of fish a week is excellent. Trying to focus on cold water fish that are high in omega-3s is healthier.
Specifically salmon, fish like
salmon, mackerel, trout, those are the fish that sort of higher in the omega-3s. And then nuts, healthy fats like avocado and olive oil are also healthy choices. Whole grains. And really, low sodium diet is also very important for heart health.
Okay. Next question. If my grandfather died of a heart attack before I was born and my dad has had multiple heart attacks and stents, should I worry? And are there any kind of tests I should be doing or anything I can do to prevent this?
Well, family history of heart disease is a strong predictor of future cardiovascular events. So in a family, especially if those events have occurred in somebody under the age of 55 for their father or under the age of 65 for their mother, that puts them at even higher risk. Things to do is just live a healthy lifestyle in terms of exercise, diet, don't smoke, limit your alcohol intake, and also just stay in contact with your primary care physician, and tests can be ordered if there are concerning signs like chest pain or shortness of breath or just difficulty doing day-to-day tasks like you've normally had, and those are some warning signs to keep an eye out for.
Are there any precautionary tests you should do, or you just wait until you have some of those warning signs?
Well, I think as long as you follow with your primary care physician, have your cholesterol checked, you're having your blood pressure checked on a regular basis. A regular EKG is worth doing as well, but beyond that, there's really no definitive tests that need to be done unless there are some concerning signs.
Okay. Next one, what does a stress test tell you?
So a stress test, actually I had a friend and a colleague who described it as taking your heart out for a test drive.
Okay.
Basically what you do is either on a treadmill or with medications, you put the heart under stress and you monitor the EKG, blood pressure for signs and symptoms of heart disease like chest pain or shortness of breath. And basically what these tests do is they tell us if there is concern for blockages and whether further testing is going to be necessary to evaluate for blockages in the heart.
Okay, let's get one more in. I always hear that we should exercise about 30 minutes a day, but what if you can't do that consistently? And is choosing exercise like lifting weights equal to yoga or aerobic exercise? Which one's more important?
Well, to answer the first part, anything is better than nothing.
Okay.
So if you can get out there 30 minutes a couple of times a week, that's great. But ideally, 30 minutes 5 to 6 days a week with focusing on cardiovascular exercise is most important. But there's no problem in doing some resistance training, yoga, spin classes, really any sort of exercise that you get your heart rate up is healthy and good for your heart.
Anything you can do.
Absolutely.
Better than nothing.
It's absolutely better than nothing.
Thanks so much for being with us to answer these questions, and we're going to see you back tonight. That call-in is from 5 to 7 tonight. That number to call tonight, 324-4357. Thanks again for being here.
Thank you very much for having me.